Most people are surprised to learn that individual behaviors and lifestyle choices, not medical care, are the biggest contributors to our overall health. And they are even more surprised to learn that our physical environment also contributes more to our health than medical care. Yet we spend over $2.7 trillion per year on medical care, but only about 15% of that on environmental protection and pollution control. Obviously, there's a disconnect between health risks and funding priorities. Perhaps we need to learn more about the importance of our environment on our health. That's why we'll be focusing on environmental protection and pollution control on today's episode of A Public Health Journal. Please stay tuned.
Welcome to A Public Health Journal, a program that explores public health issues facing our society today and tomorrow. The host of the show is Dr. Ed Ellinger, Commissioner of Health for the state of Minnesota. A Public Health Journal is sponsored by the Minnesota Department of Health and the Hennepin County Human Services and Public Health Department, all working together towards the goal of healthy people living in healthy communities.
Welcome to A Public Health Journal. Today we're going to discuss our environment and why it's important to protect it and clean up the pollution that has already been done. We'll be looking at the impact that the environment has on our health and why environmental protection is such an important part of public health. Joining me in this discussion is Linc Stine, Commissioner of the Minnesota Pollution Control Agency. Commissioner Stine has worked with the Departments of Natural Resources and Health before becoming Commissioner of PCA. John, welcome to our program.
Thank you, Ed.
It's good to be here, and just to start out, give us a little sense of what the PCA, the Pollution Control Agency, does. What's your role in our state?
Oh, the PCA was formed in 1967. Prior to the PCA, there were a couple of other boards and commissions that dealt with water pollution control. But in 1967, the state pulled together one agency to deal with pollution and pollution prevention, solid waste management, and so forth from a number of different places. Basically, the agency exists to protect and improve our air, our land, our water, and enhance human health.
Okay. Now, what's the difference between environmental health and environmental protection? Because we do environmental health at the health department,
right,
and you do sort of environmental protection.
Right. The environmental health work of the health department is really focused on protecting people and populations from environmental exposure risks. So things in air, things in water, things in the soil that might create acute or chronic health risks for the population. So things like drinking water, safe drinking water, how private water wells are constructed, and radiation sources. Those are things that the health department deals with. The Pollution Control Agency is in the business of making sure that the environment in which we live, our outdoor environment, is healthy and safe and can be productive for ecological systems as well as human.
All right, so I work to protect people from the environment, and you work to protect the environment from people.
That's exactly right.
Okay.
So we're in the business of cleaning up things that people made a mess of and preventing those things from happening in the future.
And I know you brought a slide that sort of gives a cycle of environmental protection. I'd like to put that on the screen and
Sure.
walk through that. Tell us a little bit about what we're seeing on the screen here.
Well, our goal at the top of the slide, of this sort of flow chart, a diagram of our life cycle, is really to protect the environment, improve the environment, and do the same for public health. We base that on scientific research, so our agency is built on a lot of scientific data and research around air, land, and water. We employ chemists, biologists, engineers, all of whom work to gather public input and use the best available science then to set standards for environmental quality. So the quality of our waters, the quality of our air, and the protective levels of any contaminants in our soils. We take actions to implement those standards then through voluntary measures as well as permitting and regulatory standards, and then education as well. And then we assess how our environment is doing and make adjustments from there. But overall, our goal is to make sure that our air, land, water, soils are improving over time, not degrading.
Mm-hmm. Well, and I want to talk a little bit about at least a couple of those. I want to talk about air and I want to talk about water, since they're a huge piece of what's going on. Yep. So give us a little background of how is air quality in Minnesota, and what are the things that we look at?
Well, Minnesota enjoys a fairly high level of air quality compared to many other states. We have the benefit of some climatic and meteorological conditions that assist us. We get a lot of air flowing across the state from the west and the south that we're not the recipients of a lot of polluted air, typically speaking. And the air in Minnesota is regulated under the Clean Air Act, and so there are permits that are required for any emissions. Think of them as smokestacks or discharges, emissions into the air for a lot of things. And Minnesota has a good, solid track record of reducing those point sources of emissions.
Okay. Now you've got a slide that you brought along that looks at pollution from point source, improving.
Right.
Tell us what we're seeing here with lead and PM10, whatever that is,
Sure.
and NOx and SO2.
Yep. So these are all the things that come out of point sources, smokestacks, and other specific businesses, industries, or power plants that produce these emissions. So what you're seeing in this slide is sort of 10 years of data from 2001 to 2011 showing that we've made significant reductions in those pollutants that come out of smokestacks. And their lead is a result of burning fuels, of burning petroleum-based products that contain lead. PM10 is particulate matter. Think of it as fine soot. So anything that burns carbon produces that particulate matter. And then NOx is the nitrous oxides, and those are a byproduct of burning things again, or using certain chemicals and compounds. SO2 is sulfur dioxide. It largely is a source, comes from coal-fired power plants. And then VOCs are volatile organic compounds. Those are produced by a lot of man-made materials. Think of a dry cleaner. The dry cleaner emits volatile organic compounds into the atmosphere, and they're required to control those emissions.
Right. So when we're talking point source, now tell us what point source means.
Point sources means you can put a point on a map where the material is coming from. So it's those are considered like smokestack emissions.
Okay, and so we're doing well, it looks like.
We have done very well, and the people who we regulate across Minnesota have done their fair share of reducing their emissions.
And how much of our air pollution is due to point source emissions?
I think historically, if you go back into the 60s and 70s, we all know a significant share of our pollution was from point sources. You couldn't leave your windows open at night if you lived in town. You couldn't hang your clothes out on the line certain days when things were being burned. Now we have done a great job of reducing our point sources. So they've dramatically reduced over the last 20 years. We now have other sources, the non-point sources, that are the real problem.
Okay, well, let's take another look at this next slide that you brought about air quality and key air pollutants in the Twin Cities. And we can see a trend here that these lines that I think we have the wrong one up here, but we'll get the graph showing that fine particles and ozone kind of going down. Sure. Tell us a little bit about what we're talking about here.
So the whole premise of the Clean Air Act is to set standards for human health. Healthy air to breathe is really the question. And the standard for particulate matter and ozone are really designed to protect people who are vulnerable to asthma attacks and other forms of respiratory diseases, either acute or chronic. So what you see on this slide is that red dashed line is the standard. That's the amount of particulate matter or ozone that can be allowed in the air and stay in attainment with the federal air quality standards. And these lines that you see on there for fine particulate matter and for ozone are just different ways of measuring that particulate matter and ozone in the air. And the goal is to stay below that red line. Mm-hmm. One of the things we know about emerging health research is that red line is likely to go down because people are more and more susceptible to fine particulate matter impacting their health as well as ozone. So the federal standards keep getting stronger in a sense. So that red line will be coming down. And this graph shows the Twin Cities metropolitan area and what we monitor as an average across the metro area. We're currently meeting all the federal air quality standards except for that 1 year where you can see in 2010 we bumped up on the green line for ozone. But that was a very hot, unusual summer weather pattern that probably resulted in that. And now our goal is to stay in attainment with whatever the future air quality standard will be. So we see that being driven by a lot of the non-point sources, vehicle emissions.
Right. So do you think our economy, which has not been doing well, has been helping to keep things under control?
Absolutely.
And if our economy starts to come back, are we going to have troubles meeting these standards?
Right. Just exactly, Ed. When the economy heats up, these air pollutants will heat up as well, because the more business, the more vehicle traffic, the more emissions will be created, the more energy we'll use for our community. So as the economy heats up, we expect to see some increases in these emissions. So we're working right now to try to get ahead of that and work on ways we can reduce emissions proactively.
Mm-hmm. So we're, going to be challenged because the safe level is going to go down as we learn more about it. And as the economy goes up, it's going to be a stress to keep us in compliance.
It's going to be a challenge. And if we were to go into non-attainment, that means we'd be like Chicago, Milwaukee, Los Angeles, the whole East Coast, where we would have to implement under EPA's regulations and requirements of the Clean Water Act or Clean Air Act, we would have to take aggressive actions to reduce emissions. That could mean limits on transportation, limits on hours of operations for certain businesses and activities, and that would be could be damaging to the economy.
Yeah, so we don't want to go there.
Right.
All right, I want to talk about water next, but first we need to take a little break.
Great.
We'll be back right after this message. Welcome back. We're talking about environmental protection with John Linc Stine, Commissioner of the Minnesota Pollution Control Agency. John, we talked about air, and It sounds like there's some good challenges there. And now let's talk about water in this land of 10,000 lakes, in a time when people are really paying a lot of attention to water because of the potential drought, and that's probably going to be the next oil, the big commodity. So give us a little sense of what you're doing with water and protecting water in Minnesota.
We work to protect the watersheds of the state. Now, watershed is really all the land that contributes water to a specific body of water. So think about, we know the Mississippi River drains a huge part of Minnesota. It comes from Lake Itasca on down through Little Falls and St. Cloud into the Twin Cities and exits the state down by the Iowa border. So all the land that drains to the Mississippi River is called the watershed of the Mississippi River. Our work is to protect and restore watersheds and figure out the science of those watersheds. So we do assessments of 81 watershed areas in Minnesota to understand the science of how water quality is changed chemically, physically, and biologically, how it's impacted by everything we do on the land and everything that dumps into the water. So those are the ways that we first identify problems and then work with a number of other partners to restore and improve water quality.
All right, and you've got a little chart here, a graphic here that shows what we're doing with lakes in Minnesota over the last decade. What are you seeing here?
Well, this is just a chart showing of the 1,500 or so lakes that we get monitoring information from citizens. So these are folks who go out in their boats during the open water season of the year, put a Secchi disc, a white and black circle down into the water to see how deep they can see into the water. This information represents the trends that we're seeing in those 1,500 or so lakes. About 2/3 of the lakes really aren't showing anything statistically significant in terms of changes in their clarity. About 10% of the lakes are getting worse in their clarity. That means things aren't going the right direction. The good news is 25%, the water quality and clarity is getting better. Clarity is really driven by the amount of phosphorus in the water. And phosphorus is what makes plants grow. So the phosphorus is what makes algae grow in the water. And so when we see increasing levels of phosphorus, you're going to see decreasing water clarity. So the goal is to keep more phosphorus out of lakes. And some of that comes from our own lawns, from our neighborhoods when we mow our grass clippings into the street or we dump our leaves into water bodies. Those things create phosphorus. That's like fertilizing our lakes. So we've got to do a better job of controlling that amount of phosphorus in our waters.
Isn't this a cultural change that needs to occur? Certainly, I know people who have lake places, love to mow it and have it look just like their suburban lawn. How do we change that view that wild is good?
Well, that's a great point, Ed. We are known in Minnesota for loving our lakes to death. We're actually contributing to the problem ourselves through the actions we take. So more natural areas on your lawns, on your yards, and certainly as you get closer to the water, a greater and greater buffered area where you let the nature do its work. Let the natural vegetation grow along the shoreline, and even within the first 20 to 40 feet back from the shoreline of the lake, having natural vegetation there, just a limited amount of intrusion to get down to the water's edge, that's the best way to control discharges. There's some good news in the cities here too. Powderhorn Lake in Minneapolis has actually had a remarkable turnaround in water quality because of a lot of intensive neighborhood efforts to reduce the amount of runoff from streets and rooftops going into Powderhorn Lake. So they're infiltrating the water through rain gardens, and they're getting more and more water quality improvements in the watershed of Powderhorn Lake, and it's actually going to come off our impaired waters list because of citizen action.
Yeah, so actually, this is both an urban and a rural issue, and you can do things in both places.
And it's easier to do in the rural landscape because you got more space. But even in the city, we've seen a lot of aggressive citizen-led action that can improve water quality.
Haven't there been some policy changes about what products, phosphorus, I know, taking phosphorus out of a whole bunch of products. Are there things like that are being done?
There are a number of things in terms of fertilizer regulations at a number of local units of government, and certainly restricting your use of phosphorus on fertilizers in areas that drain to lakes is an important product stewardship approach. The other thing that, of course, is beneficial is that we just use less non-organic materials in our yards, and all of those pesticides and fertilizers that go into our runoff. We just need to use exactly the right amount at exactly the right time. Then you'll get the desired benefit without contributing damage to the lake.
Okay. I want to talk about the impact of agriculture on water, but first we need to take another little break.
Great.
We'll be back right after this message. Welcome back. We're talking with Commissioner John Linc Stine for the Minnesota Pollution Control Agency about health protection through environmental protection in Minnesota. John, I know agriculture is a huge part of our economy, a huge part of our culture, and it has an impact on water. What's going on with ag?
Well, there are a number of good things that have happened in terms of how best management practices on agricultural lands have been reducing the amount of sediment loading into rivers and streams and lakes across the state. However, there are some challenges ahead, and we're working with the Department of Agriculture to improve water quality through a voluntary program working to certify farmers as implementing the best management practices on their land. We're going to be choosing 4 pilot watershed areas. One of the main problems that still faces agriculture is getting the right amount of agricultural fertilizer on lands without not too much. We're seeing increasing levels of nitrates in our water bodies around the state, and nitrates are harmful to the health of the aquatic ecosystem. They can also be harmful in drinking water as well. We know that there's a safe drinking water limit for nitrates in drinking water that must be achieved. And so there are challenges ahead, and that nitrogen then is what lands in the Gulf of Mexico. And Minnesota is at the headwaters of the Mississippi River, and our water that contributes nitrogen into the Gulf is what's creating that dead zone, that hypoxic zone, where the nutrients in the water use up all of the oxygen, and when all the oxygen's gone, all of the critters and fish die. And that hypoxic zone, that dead zone in the Gulf, is continuing to grow. And so we've got to get ahead of this nitrogen problem.
Okay. Now, there's a whole variety of things that we could talk about, and we only have a few minutes left. So, but what are the things that are sort of popping up from the general public that you have to deal with that might be of interest to our viewing audience?
Well, I think there's a ever increasing interest in the amount of garbage that we produce in the state and how much we can do better at recycling and composting of our solid wastes. We are one of the leading states in the nation. We have about a 45% recycling rate. We think that about 70% of the solid waste that we generate could either be recycled or composted. Our goal is to reduce the amount of landfilling. We still landfill almost 30% or 40% of our solid waste. And that just leaves a legacy on the land and on our groundwater resources that we could prevent. So we hear a lot about recycling, about garbage, also quite a bit about toxic substances and the amount of materials that we continue to use in our commercial products that wind up in the environment. Things like triclosan, which is a compound that is in soaps, in antibacterial soaps that we all find in the stores where we shop. That triclosan is finding its way into our water bodies. It's found in lakes, it's found in rivers, and it can convert from triclosan to dioxin, and dioxin at higher levels can cause damage to our fish. So it's like we're starting to see some of these toxic materials in our soils and in our waterways, and we get a lot of questions from the public about that. What should we do, and what should our public policies be regarding those kinds of materials?
Well, and then today in the paper we just saw about, don't use a power mower and don't use a burn barrel. Right. What's going on with that?
Again, those are those distributed sources of emissions to the air. They contribute particulate matter into the air, and they can contribute to ozone and other sources of air pollution. So you're going to hear things over the years about your backyard fires, whether you're having them for recreation or burn barrels. Across Minnesota, there's still over 250,000 households that are burning their garbage in burn barrels.
Wow.
And that's concerning to us because of the number of emissions that come from those low temperature fires. The thing that's bad about a low temperature fire is it doesn't consume up all the bad stuff. It produces more toxic materials in forms of dioxin and furans and other contaminants that fall on the land and that fall on our neighbor's land and on our own families that live there. So we got to get rid of the future of burn barrels across the state. Now that's an unpopular thing when you don't have a very good waste delivery system in your community. So we got to strengthen solid waste management. Then all of these non-point sources, the lawnmowers, the vehicles we drive in. Those are all sources of air emissions that we got to find ways to reduce.
Yeah, well, and it would be good exercise with a hand mower.
Absolutely, good exercise. Riding your bike and walking and using public transportation is another way to reduce air emissions.
Yeah, well, that's what I find really remarkable is that actually the things that improve the environment actually improve your individual health, not just from air quality, but because you're moving more.
Exactly, and so it's like the win-win. It's inexpensive workout. I personally like to walk to the bus, ride my bike to the bus, and then take the bus. And when I walk more, I feel better. I'm much more physically active, and then I know that I'm getting my health workout for the day without paying somebody for that gym membership.
Right. Another thing I want to bring up is, and I know this is a struggle with folks, what to do with medications that are left over.
Right.
And how to dispose of those. I know in the past the docs would say, just flush them down the toilet, but obviously that's not a good thing.
That is not a good thing. They're actually better off to be incinerated or put into the solid waste stream and go to the landfills, because landfills now are designed to contain everything. Even that sort of leaches out through the water and everything else is all captured and protected from getting into the groundwater. So you're much better to get it into your solid waste, put it in something, in your garbage can, in a container, and then dispose of it in your solid waste. Do not flush it down the toilet.
Okay. And I know for Earth Day this year, you sent out something about driveways. Now, what do driveways have to do with the environment?
Again, another great product idea that we didn't fully understand its consequences. We use coal tar-based sealants. These are byproducts of coal burning that then we create a sealant that we all put on our driveways. Some of those sealants then wash off progressively over time. Most everyone knows they don't last forever. And where are they going once they wash off your driveway? They're going into our wetlands and into our streams and into our lakes. And so we're actually seeing increasing contamination of the sediments in our waterways because of that. So we want to get those coal tar sealants out of the product supply chain, and we want homeowners to use a safer product on their driveway. And there are products that don't contain those coal tars that can be safely applied to your driveway and to public roads and sidewalks that will be beneficial and not harm our waterways.
So in general, read the label.
Do read the label. Read the label of everything, especially on your consumer products as well.
Yeah. All right, we're in the last few seconds here. I know you have a report card, the dashboard indicators. How are we doing generally in the state in terms of pollution control?
You know, the state is doing well in terms of our air and our land and our water. We're one of the leading states in the nation in terms of our monitoring networks and our data collection. We know a lot about our waterways and about our air. Many other states are envious of the investments that we've made through the Clean Water Fund, the constitutionally dedicated dollars that help us protect and restore our lands and waters. There's a lot yet to do because as we look, we learn. Right. And so we're learning many things like these emerging contaminants that need to be addressed.
Well, good. You're a good partner, John. So good working with you. Thanks for being with us.
Same for you, Ed. Thank you.
And I'll be back with a closing comment right after this message.
Getting closer to nature can get you closer to your family. Go to discovertheforest.org.
In our high-tech medical care system, we often believe that the most complex and difficult problems that face us can only be eliminated by some complex, difficult, and high-tech intervention. Most of us have a hard time imagining how we could possibly contribute anything to solving the health problems that face us. Well, let me tell you about a simple environmental health intervention that helped change history. In 1854, cholera deaths in a part of London were rising rapidly, and the city was in panic. John Snow, a physician in the area, investigated the outbreak and found that the people dying from cholera had one thing in common. They all drank water from the pump that was located on Broad Street. Armed with this information, John Snow went to the local authorities and recommended that the pump handle be removed from the Broad Street pump. As soon as it was removed, the number of cases began to diminish and eventually disappear. John Snow didn't know that the disease was caused by an infectious agent. He didn't have any high-tech medicine to treat the disease. He didn't have a vaccine to prevent its spread. All he had was information about the most common activities of people in the area and an inquiring mind that could make connections about what was happening in his community. His common sense approach to problem solving and his simple intervention of removing a pump handle stopped an epidemic and earned him the title of Father of Epidemiology. Do you ever wonder if there are problems today that could be resolved with an intervention as simple as removing a pump handle? I certainly do, and I think there are many. So to help make this world a healthier place and in honor of John Snow, let's see if we can find them. That's all for today. Thanks for watching. I hope you can join us again next time on A Public Health Journal.